One of the things that we can do as ophthalmologists is to realize the importance of referral for vision rehabilitation for any patient who is starting to lose their vision. And it's most effective when we do this early in their vision loss, at a time when they can really begin to involve themselves in the vision rehabilitation process. Vision rehabilitation is now the standard of care for patients who are losing their vision. This is something that all of us as ophthalmologists should keep in mind every day in our offices.
I have a pretty profound distortion of my visual field. The doctors I had seen were not asking me what I was seeing. So we just miscommunicated for a year and a half, really. If I'd been referred a year and a half ago when I had the problem originally, I could have spared myself a year and a half of exhaustion and my kids worrying about me and my husband trying to figure out how to make it okay.
Let's go ahead and take a look.
As ophthalmologists, traditionally, we're trained to cure disease, to make vision better.
Look down.
Oftentimes, when we run into patients who are losing their vision, it's almost a sign of defeat, or at least traditionally, it's been that. And we try our best with all the modern technology that's out there to make vision better, but sometimes we can't.
So how are you seeing?
It's getting worse. It's getting worse.
We need to concentrate more on continuing and maintaining what the patient already has. And that's a shift in thinking, the focus beyond the eye.
The entire spectrum of disease, of eye disease, can be helped with vision rehab. So it covers the spectrum of disease from glaucoma to cataracts, early macular degeneration, late macular degeneration, inherited diseases, degenerative diseases. Every form of vision loss, mild to extensive, patients benefit.
Our specialty has taken the stance that low vision care is standard of practice. And in fact, we've made it a standard part of our teaching programs for our residents. They are required to understand and to deliver low vision care to the extent that they can and to refer appropriately to low vision specialists when needed.
So basically, I reviewed the visual field that we took for you, and based on your symptoms of loss of visual field on the left side, it's very consistent.
I was quite frankly shocked. I remember my first visit watching Dr. Speraza with a patient. She took close to an hour with that patient, going really in depth.
Before I got here, I thought that it was only patients with advanced disease who were sent off here as kind of a last resort. We have nowhere else to send them, no other medicines to give them. But in fact, it's not like that at all.
Our next exercise we're going to do is finding an object, which will be the letter or number.
Okay. And they can get started in learning how to compensate very early on in their vision loss. While they're still able to see, if they can learn how to move around in their world, then, perhaps later on as their disease progresses, they'll be able to compensate much better.
So you can literally reconfigure your entire tablet from your house to be completely customized to you.
We work in teams now. I think most medicine's delivered in a team. For an ophthalmologist, may mean doing a surgery for a particular disease and then coupling with vision rehabilitation to maximize the patient's performance.
A patient with any sight loss who is having any difficulty functioning, no matter what the level, needs to be addressed by a low vision specialist.
In my very first low vision session, I was taught to look down until I saw my feet so that my brain would know where my feet were. Okay. And I do very little stumbling since then. It's pretty amazing.
I'm an ophthalmologist, and I specialized in ophthalmology and eye surgery. Here's the white light. I was distressed by how often I found myself saying, "I'm sorry, that's all I can do for you." Out of that frustration, I actually decided to do further training in low vision rehabilitation. I fell in love with it and realized there was a lot could be done that I had been missing previously.
I first developed signs of macular degeneration 5 years ago.
Most patients with macular disease also have blind spots in their vision. And these scotomas make reading very difficult because part of the word or part of the letter may disappear. So by enhancing their vision, making it larger with magnification, making the contrast better, increasing illumination, it makes it possible for individuals to see the letters they were not able to see previously.
I just needed to be told what to do. My reading abilities have become much easier and less frustrating.
Low vision rehab makes us excited that we have something we can offer our patients. We're able to say, okay, maybe we've done everything we can at this moment for you, but we have another team that will help us improve your quality of life.
Today's been great. Mostly just realizing that they have so many ideas here that this really is going to be more comfortable for me, and pretty quickly too.
If I can't totally cure their problem, am I still interested in their quality of life? I hope the answer is going to be yes. To insist that they participate in rehabilitation.
It really makes all the difference in the world.
We have the opportunity to change these lives by getting these patients into a vision rehabilitation process earlier and earlier. This is now the standard of care.